couple other things from this morning to get together. Lieutenant Governor McGeehan made it clear she didn't have all the answers on how this should be resolved, other than just asking the hospitals to withdraw their get vaxxed or get axed policy. Lieutenant Governor did concede maybe there could be considerations when it comes to COVID vaccine reluctance. According to the healthcare companies that announced these requirements a week ago, there are already a couple of outs with the medical and religious exemptions. McGeehan said those aren't enough.
Those are options, but medical and religious exemptions are not easy to come by. And so maybe that's something we need to look at. Are those so restrictive that it may not apply to everybody? If it's not religious or not medical, just simple conscience that they just don't want to do it, that should be respected somehow.
Well, those companies could argue they do respect those that just don't want to do it, and they would kindly respect them from a distance while they look for alternative employment. As for those medical and religious exemptions, Lieutenant Governor is correct. They're not easy to come by. When we spoke with St. Luke's about this last week, they told us a board of clinicians will decide who gets those exemptions, the medical ones anyway, just like they already do with the flu vaccine. And it is a rigorous process. And those that get them, especially the religious exemption, we're told is a very low number, like less than 5%. But I would guess that's the point, because if exemptions were easy to get, what would be the purpose of the requirement? Wouldn't really be much of one, now would it? So let's say the Lieutenant Governor and all of those in attendance today get their way, and the state of Idaho decides to tell private businesses they cannot discriminate against an employee because of a personal medical decision. Where does that stop? For example, if a chiropractor in Meridian decides he doesn't want to serve patients that have had the vaccine, stay with me here, would it be okay if he wanted to require the same of his employees, demand that they not get the vaccine or not come into work?
Well, I think that's a dumb thing. It's a dumb decision by the chiropractor. I mean, seriously, if you are an employer in the state of Idaho right now, you know how difficult it is to find employees right now. And I would never do, as an employer, I would never do anything silly like that, because I want my employees and my business to take care of the needs of our customers.
But he would have a right to do that.
He may, but that's silly for a business owner to run people off like that.
Maybe silly, but it's true, and it could happen. That chiropractor I mentioned, his name is Dr. Stephen Baker. He has a practice in Meridian with 4 employees, and he also has quite the interesting perspective on the pandemic and the COVID vaccine that we won't get into here, because he also has a podcast in which he said in an episode back in May, he was concerned the vaccine, not those that got the vaccine, but those who were just around those that got the vaccine. He was concerned it was having a negative effect on menstrual cycles. It's not.
So I instituted an office policy where if you are a member of my practice, if you're a patient and you make what I would consider a horribly poor decision to go get this shot, then you need to go home and not come back to the office for 30 days.
Dr. Baker told me today he's not kicking anyone out for good, but he didn't have a reason for that arbitrary 30-day number. He's still gathering information, and yes, he's lost some patients because of that policy. I also asked Dr. Baker if that policy would apply to employees, and he said this: none of my employees would ever get the shot because they are too intelligent to do so, and if they did, the same policy would apply. I would ask them to stay away for 30 days in an effort to protect people in my office. Would that be a paid furlough? Well, he said that would be a situation-by-situation basis. Doesn't really matter, because with all the nuance to this, all of the things we may not consider because, well, that would be silly, the bigger serious question is how far are we willing to go with this? Are we willing to let a pandemic force us to rip open a Pandora's box of government intervening in private business? It's okay for an employer to discriminate against an employee who made a medical decision to get vaccinated, but it's not okay for an employer to discriminate against an employee who made a medical decision to not get vaccinated.